of everything that we do in healthcare should be focused on the patient. We should be concerning ourselves with how people can get better access to a doctor, how they can have a reasonable time in a wait list, or getting urgent care when they need it in an emergency room. And there's probably 20 or 30 things that you could do, but there's really 4 or 5 things that you must do. First of all, we have to have a greater commitment to primary health care. And this is something that was an important initiative that was started in 2003 when I was health minister. Now, about 80% of doctors work in a primary care network with a team of other health professionals so that you don't need to see a doctor each and every time you go in. If you twisted your ankle, you might see a physiotherapist instead. And primary care networks are available 7/24. We also have to organize the system better so that instead of your doctor calling up all the doctors that they know, all the specialists that they know to get you an appointment, there should be one number that that doctor calls for a centralized reservation system. We also have to have a greater commitment to continuing care options for our seniors. And finally, we have to focus on promotion of wellness. These are the ways that we're going to make a sustainable healthcare system where we can bend the curve on our growth in expenditures and actually spend our money more responsibly. We don't need more money, we need to organize our system better.
Healthcare matters to Albertans. We know that. That's what Albertans are talking about. We can make the system better if we ensure that we have access on a regular basis. So I'm a mom, I have a 9-year-old. I need to be able to get medical services in a timely fashion. I need to be able to make sure that my parents can get that information that they need. I talk about family care clinics, where we'd have clinics that are open from 7 in the morning to 9 at night, publicly funded, where I could choose to see a doctor or a nurse. Either the doctor or nurse could see me, give me the medical services that I need so that I'm not having to make that decision at 11 o'clock at night as to whether or not to go to emergency. And if we can provide a clinic service like that, where families are connected to medical professionals in a multidisciplinary team, we're going to be able to see people take more responsibility for their own health care, and that's going to be a good thing, and it's going to help an awful lot with access.
There are so many opportunities to make the healthcare system function better right now if we just took some action. Utilizing health professionals to their full scope of practice will allow us to eliminate some backlog and inefficiencies in the system. It's ironic that when you go and see a dentist, the dentist office gets paid even though most of the time you see a dental assistant or a dental hygienist. Yet when you go into a doctor's office, the doctor office only gets paid if you see the doctor. If we use nurse practitioners and radiologists and paramedics and pharmacists all to the full scope of practice, I don't believe we'd be short of family physicians. I don't believe we'd have such a backlog in our emergency rooms or doctor's offices, and that would add incredible efficiency and effectiveness to the system, and we can do that right now today.
You know, healthcare is an issue that's on every Albertan's minds because it touches us personally. And everybody that I've talked to that has been in the system has had issues that they've had to have dealt with, or that have had a loved one in the system. They say that the healthcare once you're in is fabulous. The issue is access. We need to change the way we access our system. That means we need to change the way that you access the system. Currently, you access it through the doctor. It's the old whites of the eyes rule. The doctor needs to see the whites of your eyes. We need to change that rule. A registered nurse, as an example, is trained to 70% of the scope of practice of a family physician. Probably trained further along the spectrum than my father was, who was a family physician. Why can't you go and see that registered nurse? Why can't your doctor send you an email that says, you don't need to come in today, I've seen the results, everything's good? We need to change the structure of the access of the system, and then we need to change how we do management information, because we need to get the value for our dollar with better outcomes in our healthcare system. So step one, change the access rules.
You know, we spend $15 billion a year in healthcare, and there has to be a way to spend it more efficiently. We have active treatment beds that are taken up by extended care patients who are terminally ill or who are chronically ill or frail. We need to get them into the community, into their homes, their family homes, or into extended care facilities. And so by doing that, we create greater access in our healthcare system by freeing up active treatment beds and also taking care of our elderly and frail in a more responsible way. That's just one initiative, and I've announced an initiative about more extended care facilities in our province, and I think we owe that to the seniors in our province.
First thing I would do would be to reallocate decision-making back to local regions and local hospitals. If operational decisions are made locally, we'll get quicker, faster, better solutions to local problems. I would also make sure that all families have more and better access to doctors through expanding and reinforcing the primary care networks. And I would also improve the home care for seniors so seniors don't end up in emergency wards as often as they do now.